flu this winter has increased the volume of very sick patients that we have saw coming into the department, in particular the elderly. And we've had a high incidence, which was unusual and a very difficult, challenging winter.
This is probably the worst year that I've seen for the amount of patients that we've had admitted with flu. You know, at one point we had every single side room used. Capacity and flow was a big issue.
Before we had the point of care flu testing, we had to assume that patients that come in with flu symptoms had flu. We had to treat them as such. We had to isolate them. We had to clean the whole cubicle that they had been in when they left, and they then had to be placed into a side room in admissions unit, which put an added pressure onto the admissions unit.
We do have limited side rooms, and it is dependent on where the patient can be nursed appropriately. So when we have a high volume of patients coming through our area, it does make it very difficult if we can't have them in the appropriate area.
So the point of care testing has enabled us to within 30 minutes be able to determine if that patient has flu or not. And the difference for the patient is if they are young and we can confirm they've got flu, we can send them home with confidently with Tamiflu. If they're elderly and they've got confirmed flu, we can place them into the right section of the hospital and isolate them. And if they've not got flu, we know that we're basically treating an underlying illness.
It's like night and day in the sense that initially, I'll be perfectly honest, initially thought it's another extended role, another job to do here, which would then impact your working day. However, once we're trained to use the machine, then we can get a patient in, we can promote that patient's journey, make it more effective. They're diagnosed a lot quicker, they can get the treatment they need a lot quicker, and then we can make a decision whether that patient actually needs to stay in hospital. It lets us use our resources a lot more effectively.
We're very well supported from the laboratory staff in that we touch base with them on most days.
We had great training on it as well, showing us how to use the machine properly, to use these resources effectively. So I feel that we were really well supported.
Next flu season, I'm hoping that this system will come in much sooner. I felt that we were a little bit late on the uptake of it, in that it was January before we got it, and we probably should have had it in October. It would have made a huge difference. I
would actually hope that it was in maybe just a little bit earlier, to allow us to really, tackle the situation head on. But certainly it really helped us with our capacity, our flow, and essentially for the patient's journey as well, that they get the right treatment that they need